The public health director here in Quebec, or I guess this might have been Christian Dubé, thinking about the idea, because apparently Ontario is doing this. If you get COVID, you're supposed to, the rules as they are right now, you're supposed to self-isolate for 5 days.
5 days and wear a mask for 10.
Now, you remember at the beginning, I think the self-isolation was 7 days, if I remember back, a year ago, whatever it was. Now it's 5 days. But Ontario is saying, yeah, you don't need to do that anymore. I know there's probably a sort of split reaction in the medical community to this. I think it was Chris Labos this morning saying, I'm not so sure that's a good idea. Dr. Matthew OUGHTON is a physician in the Division of Infectious Diseases at the Jewish, and he's on the line right now. Dr. OUGHTON, thanks for the time.
Well, thanks for having me on.
Can I start by asking, just right off the top, this idea of cutting back 5 days in self-isolation once you've tested positive for COVID, is it a good idea as far as you're concerned?
I echo Dr. Lavas' comments. I don't see that this is a good idea now. I guess two things. The first thing is I would like to have an explanation as to why it's a good idea now when we appear to be heading into our more usual cough and cold and flu virus season. There are indicators that we are having more COVID infection, as evidenced by the fact that we went above 2,000 hospitalized patients with COVID-19 for the first time in the last few months yesterday. Not only that, though, we are, I think, on the cusp of starting a probably bad and early flu season. So I don't see what the rush is in that context. And I have to say, you were just playing some Depeche Mode music that made me think of my earlier days. And I remember one of the things my mother always told me, which was, if your friend jumped off a bridge, why do you have to go and jump off a bridge as well? And I think that same principle should apply here.
So, well, let me ask then, with respect to being infected, right? So you test, you're positive, it's day one. What's the scenario for you? How long are you still contagious? I mean, are the 5 days in self-isolation because you still could be contagious?
So there's pretty good evidence, and of course, to be fair, a lot of this evidence comes back earlier on in the pandemic with different variants, and certainly variants can change some of their behavior, including things like time from infection to when you first have symptoms and total duration of infectivity. But there's a lot of evidence to say that once infected, most people can certainly be infectious for 7 days and even 10 days, which was the original marker that we had used, back towards the beginning of the pandemic. 10 days is a reasonable estimate. So, as you correctly pointed out, we've already sort of cut back, initially saying 10 days, now saying 5 days, and wear a mask for the next 5. So, if our goal is to try to reduce overall in a large community the number of people who are sick and infectious who are moving around, you would think that this would be a step in the wrong direction.
Fair.
All right. So I want to ask you about flu season, because ostensibly there has been no flu season since the pandemic began, or much, diminished. Is it going to be, when you say you suspect it's going to be bad, is that because we're actually more susceptible, or because we're simply not masking, or is it a combination thereof?
Excellent questions, a whole bunch of things. So we did manage to effectively eliminate flu, not only here in Quebec and Canada, but in fact in much of the developed world for almost 2 solid years. Here in Quebec, we had essentially zero flu, basically from the beginning of the pandemic, March 2020, up until April of 2022, at which point we had a late and relatively small surge in flu. I say late because usually, pre-pandemic, our flu season would be maybe something like November to something like March or April, during which time we usually have one wave of influenza A, one wave of influenza B, okay? Now, you very correctly point out, during the earlier stages of the pandemic, all the non-pharmaceutical interventions, the wearing of masks in public places, the frequent washing of hands, the not going out, especially when you are symptomatic, all those things greatly reduce the transmission of all sorts of other respiratory viruses, arguably even more effectively than it did for something that is as highly infectious as COVID-19. Is it a coincidence that influenza A started to come back when we eliminated the requirement for people wearing masks out in public? Probably not. So that's the first, I guess, line of evidence or argument for why we're at risk. Second one, exactly as you point out, we had virtually no circulating circulating flu up until at least April of this year. So that means that overall the population exposure to influenza virus over the last few years relatively low. And I'm pretty sure when we finally get the data on seasonal flu vaccine uptake over the last year, that was also probably really low. So again, pointing towards more susceptibility. Third line of evidence is influenza A. So in the southern hemisphere, their flu season happens 6 months offset from ours, right? That's just the nature of, having a globe where the winter season here is the summer season in the southern hemisphere and vice versa. So Australia just recently finished their worst flu season of the last 5 years, marked by a very early onset of flu, a very severe presentation compared to average, particularly in younger patients, mostly sort of children and teenagers. And there's already early indications that we're starting to see that. Not here yet in Quebec. We still have only a handful of confirmed flu cases, but we're already starting to see an early onset of flu in the southern United States, and it's very, very likely we're going to see the same onset here. So you put all these things together, I think we have the combination for a bad and early flu season, and certainly we now know that one of the things we could do is wear masks, but those are no longer mandatory. But I think that probably goes to Dr. Dubé's suggestion from the press conference yesterday that he still recommends people wear masks even though it's no longer mandatory.
All right. Dr. Houghton, in fact, covered a lot of stuff in there. Thank you so much for your time this afternoon.
My pleasure.
Appreciate it. Dr. Matthew Houghton over at the Division of Infectious Diseases at the Jewish